Welcome back to First Coast Living, folks. We're up here at the RSM Classic, and these guys are getting ready to go start the second round. One unique thing about a PGA Tour event is that they have physio trailers right on the backside of the range to stretch them out and get them ready, and maybe some rehab if they need it. But us weekend golfers, we don't have that. I'm joined right now by Dr. Bo Sasser, who's an orthopedic surgeon with Summit Sports Medicine, Orthopedic Surgery, and Southeast Georgia Health System. Weekend golfers don't have the luxury of an athletic trainer in a trailer 20 yards from the range.
Right.
What kind of injuries are you seeing most in golf?
You know, with these athletes, they're at their top-notch level, but they have to play every single week. They play 4 rounds, and so you see a lot of overuse type injuries. You see a lot of shoulder, back, wrist, even some hip and knee injuries just because of the amount of force and torque they put through their body with these big swings. With the average amateur golfer, we see the same thing, but it's usually secondary to a lack of good conditioning and stretching and strengthening.
So let's talk about it. Like I said, these guys, they get stretched out by professionals, and they have obviously trainers and swing coaches. But for the average golfer out there, what are some ways that they can try to prevent the injuries when they go out and play once or twice a month?
Well, right when they get out there, I think it's good that they shouldn't get out to the range, hit about 10 balls, and then go ahead and start their round. I mean, you need to get out here, you need to get stretched out, and that's with any sport. You see that with baseball, you see that with soccer, you see that with tennis. You have to warm up properly. So that's nice, easy stretching, getting out there, hitting a few balls, and then working into your game so that your body's ready to play.
And once they, unfortunately, if somebody does get injured, what are kind of the different, if you're talking, for me it's the lower back is what I'm usually kind of dealing with. What are some of the treatments and things that you guys do with them?
Well, especially with the back, we focus on continuing getting moving and working on conditioning, therapy, flexibility. You got to work on that flexibility, and then as you're feeling better, getting back into that activity with lower impact type activities. One
of the things that I think, and we were talking about this, that's important, getting lessons and getting properly trained, because some of the injuries come from, not proper swing mechanics, right?
Right. Well, by the time you see me, I'm just trying to put a Band-Aid on it, but yet if I make you better and get you back playing, if you still have bad technique, you're going to keep coming back and seeing me. So it's very important to get an instructor, get some lessons, work out the kinks, and so that can prevent injury.
Something else that I am not great at when I'm playing is I'm usually, and I think a lot of people can relate to this, I'm usually rushing. My tee time's at 10:30, and I want to get there early to warm up, but I don't get there till 10:15, and that's a problem.
That's a big problem, because then all the joints, the ligaments, the muscles, they're cold, and so you take that one big swing and then you hurt something.
All right, and so anybody out there up in this area that may have swung too hard, or maybe dealing with a weekend hacker injury, what's the best way to get a hold of you guys and come see you?
Well, you can actually go onto sghs.org, or you can call our office at Summit Sports Medicine and look us up on the internet.
And those guys that are coming in, what do you have? Are you keeping track of the handicaps of what their index is for the guys who are coming in the most? Who's getting hurt the most?
It's still the weekend warrior. It's truly still the weekend warrior, or the guys that go out and they go on a trip with a bunch of their buddies, and so they're playing 36 holes a day. So of course they come back after 3 or 4 days and something's hurting.
Well, like we said, they have a trailer right there. They can go get stretched out and have their doctors and rehab. But us weekend golfers out there, let's get stretched out. Do it right. Appreciate your time,
Appreciate
Doc.
it. Thank you, sir.
Thanks to you and Southeast Georgia Health Systems. We got a bunch more coming up. If you want to get a hold of them, you can go to their Dr. Sasser. You can visit sghs.org/summit-RSM. That address is on your screen right there. Or you can call 1-855-ASK-SGHS. That's 1-855-275-7447.